patient's room.
Okay.
Hello, Mr. Seymour. My name is Sandy. I'll be your nurse today. I'm going to do a head to toe, so I'm going to listen to your, I'm going to get your vital signs, listen to your lungs and all that. Okay? Okay. Wash my hands, provide privacy. Tell me your name and date of birth, please. Bob Seymour, 2/24/1978. Okay? So I verified that against the mark. Okay. Mr. Seymour, can you tell me where you're at today? He's at Bryan and Stratton Hospital. Okay. Do you know what today is? Today is Monday,
October 24th.
October 24th, 2022. Okay. If he wasn't alert and oriented, you can always ask him the year, the name of the president, stuff like that. Okay. Okay, Mr. Seymour. I'm going to check your eyes real quick. So he's alert and oriented times 3. Almost like pupils are equal. They're round. They're about a size 3. Okay. Now I'm going to have you stare straight ahead at my pen light, okay? His eyes should cross a little bit. Okay? So pupils equal, round, reactive to light, and accommodation. Okay? I'm going to have him squeeze my hands. Can you squeeze my hands as tight, as strong as you can to check for equal, of equal strength, okay, in both hands, okay? Then I'm going to have him push down with his feet. Like he's pushing down on the gas pedal, I'll tell him. And I'll have him push up. Check him for equal strength, okay? Okay, Mr. Seymour. I'm going to start checking his skin, his head, all his bony prominences behind his ears, his nose, his nostrils, because that's a bony prominence. Okay, I see he has a trach here. Okay, so it's hooked up to the there. I can only get 1 to 2 fingers in there. Okay, the dressing, coca. Okay. It's attached right. Okay, I'm gonna look at his abdomen, his belly, his skin, his chest. Okay, I'm gonna listen to his heart sounds now, okay? So I'm gonna listen to the aortic, the pulmonic, the tricuspid, and the mitral valve, where I'm going to count for a full minute.
Mitral.
Is it regular or irregular? Okay. Then I'm going to listen to his lung sounds. All 8 spots. 1, 2, 3, 4, 5, 6. Actually, there's 10. 7, 8, 9, 10. Okay. Are they clear? Any wheezing, crackles, whatever? Regular or irregular? Is his chest symmetrical or not? Is he having labored or unlabored breathing? Stuff like that. Okay? Now I'm going to listen to his belly after I look at his abdomen. Assess his abdomen first. Then I'm going to listen to his belly in all 4 quadrants for at least 5 minutes in each quadrant until I hear something. Okay? Is it normal active, hypoactive, or hyperactive bowel sounds?
Question. What does it sound like when it's hypo?
Hypo? Like less than 5
It's
clicks
a weird.
that you hear?
Okay.
Okay.
So hyper.
5 minutes for each quadrant, or all
If you
together?
don't hear anything, you want to
Oh,
listen
okay.
for at least 5 minutes.
Okay.
So you hear something, okay?
Okay.
Unless you're gonna do head to toe on somebody else.
And it's gonna sound like it's
Doesn't matter.
growling, right?
Yeah.
Okay.
So you could do it on a real person if you want.
Okay.
I'm gonna palpate the belly. Okay. As I'm, any tenderness, any pain. As I'm looking at his skin, I'm looking at for bruises, rashes, lesions. Okay, I'm looking at the color of his skin, the moisture of his skin. Is it dry? Is it moist? Okay, the color, the moisture. Is it warm? Is it cool to touch? Okay? Any pressure ulcers, any wounds, any dressings? Okay? I'm gonna check his pulse sites now. We have the carotid. We have the temporal. We have the brachial. We have the wrist, which I'm gonna be doing his vital signs, so I'm gonna check his radial pulse. Okay, for 30 seconds times 2. I would check his respiratory rate.
Okay.
I would check his blood pressure, the 2-step method. Check his temperature.
Okay.
Are you having any pain, Mr. Seymour? Yes, he is. Okay. When did your pains, what started the pain? Okay. How would you describe your pain? Sharp, dull? Okay.
Okay.
Is it radiating anywhere else? How bad is on it on a scale from 0 to 10? 10 being the worst pain ever. When did it start? Does it come and go, or is it continuous? Going back to his pulses, okay? His popliteal, behind his knee.
Yep.
His femoral, okay? He does have pulses, guys, when he's turned on. His femoral pulses do, because they have the little click, okay? His dorsalis pedialis, you just follow the toe. Uncover your patient so you can see their skin. Dorsalis pedialis and posterior pedialis. Okay? I'm looking at his skin.
Where was the dorsalis on top, right?
Huh?
The dorsalis was on top?
Mhm.
Okay.
And the tibia is where you line up
And
with the.
like right behind the ankle bone. Okay?
Right behind the ankle bone? Okay.
Any edema. Okay? I'm gonna check for cap refill. Less than 3 seconds. Okay? I'm gonna turn him over and look at his backside for pressure ulcers or anything like that, especially his cocks, pressure ulcers, right? Oh, have you had a cough today, Mr. Seymour? If you had a cough, coke of the sputum. Okay? And then, if you would have a Foley catheter, what size Foley catheter does it have? Is it hanging on the appropriate side of the bed? How much urine is it? The coca of it. Okay? Or you have nasal cannula, I think, and you have NG tube. You only have to name 2 of those. Lines, drains, and airways.
Verbalize this, right?
Yes.
But if we do it on him, do we actually have to look at his tray?
Yeah. Because he has one. Because it's going to remember you of what else you need to check for on him.
Okay.
That will help you. Then when I'm done, I'm going to put him back into position, however he was, however comfortable he was.
Okay.
Wash my hands, go document, make sure the bed's down, give him his call light. And that's his head to toe. Did I miss anything, guys? Nigel's trying to think hard over there.
Yeah.
He is.
So if we do the tray and
Because he always catches me, but I don't think he caught me this time.
He was ready.
Huh?
You got a phone in
I named 2. I said the trach and I said
you
the...
said it.
You said the wheezing and the crackles and the bronchi and the strouder?